if you just want to state your name.
Amy Sharp.
Okay, so Amy, what was your initial reason for coming in to see Dr. Cheema?
Well, a few years ago, I was involved in a car accident where I was rear-ended by a drunk driver. And I had gone through all the physical therapy and all of that. I was still having some pain and some numbness that was radiating down my arms. So I went through seeing an orthopedic spine surgeon, all of that. You know, we went through the gamut and determined that my best bet was pain management and learning how to, I guess, manage the pain and the numbness that was radiating down. And I was referred to Dr. Cheema by my orthopedic doctor, and it's been great. He's awesome.
Okay, so when you came into the office, what procedures did he do on you?
We had done some regular cortisone injections in my neck, as well as a low dose of pain management and some muscle relaxers to keep that. We had gone through, an MRI just to make sure and look at where the injury was, and I had some damage done to the disc between 5, 6, 6, 7, and 7, 8 in my neck. And that was what was causing the pain and the numbness radiating down. Really, there wasn't much of an option when it came to surgery for fixing that, besides having spinal neck surgery, which I didn't think it was that severe of an issue. Yes, it was painful. There were times that it would wake me up in the middle of the night, but I've really liked the way Dr. Cheema has been treating me. He's used some natural and I guess definitely more of a holistic approach to it, with recommending massage therapy, different stretches, things like that to really kind of keep that area loose, as well as really monitoring the medicine that I'm on.
Okay, so any of the procedures that he did, were any of them painful or, uneasy, anything like that?
Not really. Actually, what kind of gave me the most of a little flutter in my stomach was doing the cortisone injection, because I'd never had something like that done to my neck. But Dr. Cheema was incredibly comforting through that. The thing that bothered me the most was, I guess, just feeling the pressure. There wasn't any pain. And after my first injection into my neck, he had done some other therapy. Believe it was, he had done some Qigong therapy and really relaxed the muscles in my neck and got, I could actually feel like the blood pumping through that area that he was working on, really to get that, the cortisone and that to get in there. And within a few days, the pain was remarkably worse, or remarkably, the pain had gotten from worse to so much better, to where I needed about half as much of the medicine as I did before the injection.
Okay, so compared to any kind of doctors, family doctors, anything like that, anesthesiologists, how does Dr. Cheema kind of differentiate from those doctors?
When I come to see Dr. Cheema, I don't feel like I'm just pushed into a room and someone's looking at my chart and, remembering my name or anything like that. I walk in, the staff knows who I am because I've been coming somewhat regularly. Dr. Cheema always knows my name whenever I see him in the office, even before I'm in the room. And I really feel like I'm being cared for, as opposed to just being checked out. I've been to some doctors and you almost feel like their time is worth 1,000 times more than yours. I'm always seen on time. I'm just always had the feeling that I was important and that I mattered. And that just, it really does a lot for how you believe and how you feel about a doctor. Because quite often we go to the doctor or anything like that, and you just feel like you could basically be a car going in for a tune-up. But I definitely feel like an individual when I come.
Okay. And then last question, were you a holistic believer before coming into Dr. Cheemas' office?
I would say somewhat. There were some things that I had experienced in the past that definitely had helped. And I believe in trying to do as much as you can to help take care of your body, especially with, exercise, things like that. The answer isn't always a pill bottle. The answer is not always a prescription. I'm diabetic, so I understand that there are things that I have to medically take care of. But I believe in trying to be as proactive as I can for my health, not just relying on, the next greatest prescription to come out.
So would you recommend his services to other people?
Oh, and I have. My sister, who has had problems with her pregnancies and that, she has 5 kids, and she recently had twin boys, and she's been having horrible sciatica and just really, bad back pain, and to the point where there are times her legs will pretty much stop working. And my sister's been coming now for about 4 or 5 months, and she loves Dr. Cheema. I would, if anyone was experiencing, any type of pain or any type of issues, whether it be muscular or what have you, I would recommend him in a heartbeat.
Okay. All right.
Thanks.